tell us about yourself?
Well, I knew that I wanted to help others ever since I was very young. I once saw my mother render first aid to a man that had received a gunshot wound to his chest. And I admire that, and I knew that I wanted to do something like that and help others. I volunteered for the ambulance services um, in the American Red Cross. I organized a blood drive my first year of college for the American Red Cross also. After that, I joined the United States Air Force and was trained as a aerospace medical technician. I worked in the field, in the clinic, and in the emergency room. I did physical exams. I briefed people on hearing conservation, did hearing exams, and I assisted um, on small, minor surgical procedures. Um, and after I separated from the military and worked in the civilian world, I worked as a emergency room technician, um, where I did everything from starting IV lines to transporting patients and uh, teaching how to use crutches and apply bandages, things like that. I am currently pursuing the career as a nurse at the University of Texas in Arlington, and I'm looking forward to graduation May 2020.
Where do you see yourself in your career in 2 to 3 years?
In 2 to 3 years, I see myself as a more experienced nurse. I'm looking forward to obtaining more and uh, develop better skills as a nurse. I also see myself as a active member of uh, the work, the company where I'm at. I will be participating in committees such as ethics committees. I'm interested in doing something like that.
Where, what are your strengths and what are your weaknesses?
My strengths and my weaknesses. I perceive one of my strengths to be I'm very flexible. Um, I adapt to change, and I also enjoy staying active. I like being productive. I'm always moving and doing something. One of my weaknesses, I would say, my deep empathy for children, especially injured children. So I prefer not to work with that population. I prefer to work with adult population, neonate, newborn children, because I find it difficult detaching to the memories of injured pediatric children in my line of emergency medicine. So, as a precaution, I prefer not to work with that population. However, I'm very aware of it, and I do take uh, uh, precautions such as maintaining a balanced physical, emotional, spiritual, and mental health lifestyle. I practice meditation. Um, I have experience in debriefing. I've participated in them, and that's how I'm capable of working under a lot of stress and how and that has taught me how to take care of stress levels. I do things to prevent stress levels um, to increase. I talk to my support system. I maintain my health, and I'm in tune with myself.
Talk to us about the values of teamwork.
The value of teamwork. My perspective in teamwork is I learned the true meaning of teamwork while I was in the military. Teamwork saves lives in the emergency room. Uh, I see teamwork as a well organized orchestra. If all the instruments are in tune and playing at the right time, uh, together make a beautiful symphony. Um, Teamwork is necessary for a company to succeed and for uh, patient care to be successful.
Please describe a situation that required you to complete a number of things at the same time. How did you decide what was the most important? What was the result?
When I worked in the emergency room in the past, I was tasked with a lot of things that needed to be done uh, before patient care, during the day, and after patient care every day. Um, what I've always done is prioritizing my tasks during the day and at the moment. So I would think about the things that I needed to get done ahead of time and then make priorities, what needed to be done first and what I could put on hold and then take care of it later. For the most part, what I did was I would come to work a little bit early and I would be prepared. I would have communication with my managers and my coworkers so that everybody knew what they were doing. We were all on the same page and we knew what we had to accomplish during the day. The rooms needed to be stocked, the equipment needed to be checked and functioning before we brought any patients in the rooms. So all that got done. During patient care, we also have a system, our ABCs and procedures that need to be done on time according to the injury or the situation of the patient. They need to be done precisely, accurately, at the right time. Um, and then after patient care, we had to make sure documentation, or I had to make sure that documentation was done appropriately in a timely manner to continue patient care, continuity of patient care. So the outcome was I always had my things done early and as early as possible, and I used my time wisely. And if I was ever in a situation where I felt or foresee that I was not going to be able to do something or get something accomplished, I communicated with a coworker or a manager and make sure that whatever necessary resources or help come to me so that things were done and patient care was never compromised.
Thank you very much, Ms. Yancey.
Thank you.